Good afternoon. Good afternoon. I hope everyone realizes that they're in the Insurance Subcommittee on Life and Health meeting, and we're about to get started. And I'm going to ask if we would have Representative Gamble, if you would give us a moment of prayer.
Thank you. Let us pray. Heavenly Father, we thank you for the opportunity to consider this legislation today. Father, I pray that you would lead us and guide us with all the decisions that we have to make. In Jesus' name we pray. Amen.
Thank you. We'll start with the first bill that we have, and that's going to be Representative Noel Williams, House Bill 63, wherever you would like. Thank you. If you would present your bill.
Yes, ma'am. Thank you, Madam Chair Lady. It is LC 520174, House Bill 63. This bill basically is going to give claims experience for groups of 20 and above to the from the insurance company to the companies that provide group health insurance. Right now in the business, when you get renewals for groups less than 99 fully insured lives, all you get is premium and claims. They don't tell you any conditions, what's going on with the group, the sickness that's going on, the severity. And a question that gets asked all the time is, well, why are my rates going up? Well, sir, because of your claims. Well, what are my claims? And you're at the mercy of what the insurance company tells you instead of having it broken out and spelled out in black and white for them. They're already doing this right now on level-funded groups and self-funded groups. We have self-funded groups down to 5 lives now. And you get that information. The information is at the insurance company's fingertips, but they're just not providing it to the employer groups or to the agents who are responsible for writing the insurance for that company. We put 20 because we figured 20 is COBRA eligible groups, and we think that makes sense. And we just think it makes everything more equitable for everybody, because the same data the insurance company is sending out, the employer gets to see, and then the agent, whomever that agent might be, when he or she sends it to the other insurance companies, they all get the same batch of information. So it kind of makes everything transparent. And I'll be happy to entertain any questions.
Okay, does anyone on the committee have a question? All right, there's no question. Other discussion? Is there anyone in the audience that would like to speak to the issue? Then the chair will entertain a motion.
Motion to pass.
Okay, and we have a motion to pass. Do we have a second? Second, we have a motion and a second. All those in favor say aye. Any opposed? Your bill passes, and it'll move on to full committee.
Thank you, ma'am.
Thank you. Okay, we have another bill to be heard. Let's see. Chairman Cooper has House Bill 85, if you'll come to the table.
Thank you, Madam Chair. You ready for me to go?
Go right ahead.
Okay, members of the committee, thank you for hearing House Bill 85. A subject that not many of us want to talk about, predominantly cancer, the terrible, dreaded diagnosis for anybody to hear, or even a severe autoimmune disease. And in the past, treatments have been basically, I'd hate to say it, but sort of a crapshoot. You would have so many different kinds of cancer medicines that might be used to treat breast cancer, or you'd have so many different kinds that would treat lung cancer. But the doctors never really knew which one was going to work for you. Now we have something called biomarkers. And biomarkers are where you take tissue or blood sample, and they found a way to compare that to different medicines and find one that is likely to be most effective for you. What it does is decreases a huge amount of suffering for the patient, also possibly shortening their life. Because if you try one medicine that doesn't work, you may be in the doctor may try that in maybe 6 weeks or 2 months or 3 months, Before you realize it's not working, the cancer is spreading, and you've lost that ground, which at times can be fatal. So this is a way to get the right medicine to the right patient at the right time. And there are not biomarkers for every illness, for every cancer, or for every autoimmune test. But this is a beginning. It's medicine right at the edge, and one that has been tested. It's not experimental, and it's not that expensive. And if it keeps one patient from getting one infusion, most of the infusions for cancer can cost anywhere from $6,000 to $10,000 for one infusion. So if the biomarker test doesn't, keeps you from giving the wrong medicine one time, you have more than about 1,000 times had a savings, not to count what an advantage that is to the suffering that the patient would have to have. So this is what bills does, is calls for the coverage of biomarkers. Many of the places in the state are doing, our Medicaid system already does it, but there's the carriers in Georgia, about 54% of them were using this. All Georgians have really not a right, but should be afforded this new and innovative approach to getting the right medicine to the right person. And I think that most of you can understand how important, that all of you can understand how important that is, especially since it will save money, not in the long run, but almost immediately, if you are not wasting very expensive drugs on a trial basis to see which one is the right one that will help that patient either live longer or go into remission from a cancer or an autoimmune disease. I'll be glad to take questions, but we have a couple of people. We have a physician from Emory, and we have a patient here that would like to speak if it's permissible.
Yes,
With the
I will
chairman.
allow some. Let's see if anybody on the committee has a question at this time. I don't see any, so we will then hear from your speakers.
And somebody did ask for an amendment, which I will put forth. I really would, prefer that it stay like it is, but when we get to that right
Okay.
time, I will put that and let the committee decide.
Okay, thank you. Jesse Wetherington, would you like to come forward? Please introduce yourself and explain who you work with.
Yes, ma'am. Madam Chair, thank you. I'm Jesse Wetherington. I'm the President and CEO of the Georgia Association of Health Plans, which we represent the commercial health insurance industry within the state of Georgia. We just had a couple of questions, and I think one of the amendment that Chairman Cooper had mentioned was one of the things that my members had requested as a clarifying amendment. But we had a couple of questions related to the bill, or would request friendly amendments kind of at the following. I can run down what those may be, and that'll probably make sense more than.
Okay, do you want to do it now, or do you want to wait until? Okay, go ahead.
So at line 46 and 47, we would respectfully request that the committee insert language that the biomarker testing be medically necessary. So that would be between 4 and biomarkers on line 47. Additionally, if this bill is predominantly related to cancer oncology therapy, we would ask for a respectful amendment to have it be clarified to be limited to cancer diagnoses, rather than sort of the broad application that's in the approach in the bill in front of you. And then I think the amendment that the chairman was going to reference was.
What about autoimmune also?
I think that also we'd be amenable to that as well, because just
Cancer
have it
and
be specific
autoimmune.
disease states that are time sensitive more than sort of any treatment modality whatsoever.
That's not what if I might, Madam Chair.
Please.
Jesse, I don't believe we're talking about something that's time sensitive. We're talking about trying to find the right treatment. So it's not about how long it takes to get the test done. It's whether and there's a right. What if the autoimmune and cancer are the ones they have now, but there's great research being done on Alzheimer's disease. What if right coming down the road is a marker for getting the right medicine on Alzheimer's, or finding out that a very expensive medicine does nothing to help that person? So, I think limiting it is not a really good idea. I would be in opposition to that one. And please remember, it does not work, and doctors, they have to follow the federal guidelines and all about ordering biomarkers. It's in the bill, just following what we're talking about. And so they're not doing it willy-nilly. They're not going to be doing it on every cancer patient or every autoimmune patient. The doctor has to feel like. And the other amendment was to make it medically necessary. I can't say the word right now. Necessary, thank you, is really putting it back into the insurance companies to make up the decision whether they're going to carry it or not, and be slow to let these patients do it and issue denials. And we all know how that goes. And if you're a cancer patient and there is some way to tell whether this medicine will immediately start to help you or this medicine is going to be a bust and you're going to get sicker, I think we have a right, and the people of Georgia should be afforded the chance to have the biomarker test to help choose what is the right medicine for them at the right time.
We have a question from Representative Davis.
Thank you, Madam Chair. Do you have any scientific evidence or anything that would show that it's cost effective and it would be advantageous to take the point of view that you're seeing?
I don't have any specific evidence for the committee today. What I would caution you, though, and as the chairman just said, this is an emerging subset of therapies and diagnostics that is going to continually probably inform more and more of medical treatment in the United States, particularly for an advanced disease or something complicated or complex like oncology or autoimmune disease. Our perspective is that the term biomarker is drawn to be very broad in this bill, and so that could run from anything. I think there's approximately 30,000 some odd identified accepted biomarkers that the FDA currently has recognized, and the number is growing. A whole gene sequence can be in excess of $1 million for a single claim. Our concern is, does this broadly written bill open the door for things that are not supported by medical or clinical evidence to be performed on a patient? And this is the same kind of thing we get up on most any mandate bill, and we'll caution you all as to the approach is, we want the right person to get the right care at the right time. We probably disagree about exactly how that needs to look.
Right, and I would be in opposition to that one.
If I may, Madam Chair, the last amendment was around the prior authorization timeline.
Where
in
is that?
subsection
What line?
62 through 66, subsection E. The General Assembly has just instituted narrower prior authorization guidelines that are sort of across the board, not just for this narrow subset of benefits that just went into effect in January that are 7 days and 72 hours. So we would just ask that those not be changed again as we've just had them come online for the whole benefit,
This is for
not just this subset.
prior. This is prior when you know you're going to get a treatment. Okay. And what is it currently?
7 days
7
for
days?
non-urgent.
And 72 hours for urgent.
Yes, ma'am.
Yeah, so that would,
And, not my choice, but I would not oppose that one. But the other two, you can talk about 1 million biomarkers. They're not using 1 billion biomarkers. And in the bill, on the lines, from 51, like that, it talks about what you must do, and it must be specific. And the physicians are not going to be using this willy-nilly. And so I would oppose the other two.
okay, thank you. Do you have more questions or more comments?
Those would sort of cover my members' concerns
well,
or questions with the bill.
Sit tight. We will come back when the amendments come up.
Thank you, ma'am.
Okay, we have, yes, I'm sorry, I don't want to butcher your name. Ramiliam? I'll try.
Thank you, Madam Chair. Good
Again-
afternoon, members of the committee. My name is Dr. Suresh Ramalingam. I'm a medical oncologist. I also serve as the executive director of the Winship Cancer Institute of Emory University right here in Atlanta. I take care of patients with lung cancer, which for a long time has remained a lethal disease. And practically 90% of the patients diagnosed with stage 4 lung cancer would die within a year or year and a half. And now the situation is dramatically different because we have better treatments. Now, if I take a step back, there are over 60,000 new patients diagnosed with cancer in our state every year. And among those, unfortunately, close to 18,000 will die from their cancers. For many of these cancers, the mortality data for our state lagged behind national averages. However, the good news is there are steps we can all take to improve that situation. And one such step is House Bill 85, which allows for physicians and care teams to get biomarker testing covered by insurance for their patients. Now, I'll tell you why that's important. Over the past 2 to 3 decades, research has resulted in significantly better treatments for cancer. What used to be just chemotherapy for cancer is no longer the case for a number of cancers. We have what we call precision therapies. These are medicines that are highly effective for patients. We have immunotherapies that turn on one's own immune system to fight their cancer without having to do anything else. We have better surgical techniques, better ways to screen for cancer. However, we know that not every patient with cancer is the same. Every patient is different. Every patient's cancer is different. And these treatments don't work for every patient. We really have to know if a particular patient's cancer is likely to respond to the treatment that we're going to give them before we start them on this therapy. Otherwise, you made a wrong turn, and by the time you turn back and come back to the fork in the road, much damage has been done. So timely decision making is important. The right tests are important. So we know before we start treatment if a particular therapy is going to work for these patients. Like one of my patients who was 38 years old 3.5 years ago when she came to me. She had just given birth to a baby 2 months before, ended up developing a seizure while she was in the shopping market, and went to the emergency room, was found to have lung cancer that had spread to the brain. And it was a bad situation. Thankfully, when we did the biomarker testing, we found a mutation in her tumor. So we were able to treat her with a pill, which she continues to date, and her tumor is completely gone. The scans are as normal can be. Now, I can't say I have cured this patient, but she continues to do really well. And these are the kind of therapies that we already have in our hands. But if we don't do biomarker testing, we will not be able to give these therapies to our patients. So for cancers where there are FDA-approved treatments, which are based on biomarkers, that's what I believe this bill is about, evidence-based use of biomarkers, these are life-saving for patients. So I, once again, thank you for the opportunity to present today and express my support for HB 85 to help make sure that every patient with cancer has the opportunity to receive the best treatments that provide them the best chance to fight their cancers. Thank you very much.
We do have a question. Chairman Carson?
Thank you, Doctor. Thank you for that. Just follow up on one thing you mentioned. You mentioned Georgia is lagging behind in regard to fatalities. I guess you're considering the number of fatalities divided by the number of patients that have cancer. You're comparing this to other states, and we have a higher mortality rate in that metric. Could you describe that some more?
Sure. So the Georgia Department of Public Health and our own institutional research every year look at our statistics for the state for every cancer. We look at it by county. We look at it by men, women, and so forth. And when you look at it, there are many cancers where the likelihood of dying from cancer is higher in Georgia than there are in other states.
For the same cancers.
For the same cancers.
So
apples
lung
to apples
cancer in Georgia is
comparison.
more deadly than lung cancer in wherever.
For many of the common cancers, that is the case. And that's the reason why, now it's not attributable to any single reason. There are many factors that go into why those differences exist. But I believe that every patient having access to biomarker-driven therapies will provide them with the chance to do well, and that eventually will help us improve nationally.
Last question. One more question, Madam Chair, lady. So Doctor, could you give us a real-world example? So take that lady, 38 years old, delivered birth. 2 months later, she tested positive or she became stricken with cancer. Could you give us an example of how that person would benefit under HB 85 versus if we don't have it, this would be her track?
Absolutely. So when this patient is diagnosed with lung cancer, there are many treatment options. Because she had the ability to get biomarker testing, we were able to send her tumor tissue for testing, and within a couple of weeks, we got the word that her tumor carried this mutation. If she did not have biomarker testing, she would have been treated with radiation to her entire brain, which can be debilitating. And the second, she would have been treated with chemotherapy, which again does not work well for every patient and has relatively modest benefit with side effects as well potentially. So her course was completely different because she was able to undergo this biomarker testing.
Last question. So if there are huge benefits to the treatment of biomarker testing, I'm trying to figure out how to word this. Would that not in and of itself, in regard to avoiding radiation therapy and so forth, wouldn't that not of in itself say, we're going to go this route regardless of insurance coverage? In other words, we're going to, if we didn't have House Bill 85, we would potentially ask the patient to come do this out of pocket because we could save thousands of dollars or tens of thousands of dollars. I'm just wondering that you're saying there's a medical benefit and that would lead to a financial benefit of doing the biomarker testing. Do you follow what I'm trying to ask?
I think I do.
Okay.
The trouble with this, when you're talking about some of these alternative treatments, they're very, very expensive.
Okay.
And trying to choose one,
That's
you wouldn't
tailored
wanna
to the
choose
patient.
Wouldn't want to have the same one for everybody. Everybody's different. Our whole bodies are different.
Right.
And how we react to medicines. And so that would be like picking what we've had in the past, radiation and some kind of a chemotherapy drug. That's what the treatment has been in the past. Not very effective, very hard on a human to do it, radiation and all. So if you picked one of the others, you'd be picking another one that might not fit, might be very expensive, and might not fit 90% of the people. They might need one of these other ones. And you need to be able to find out which one will be the best one for you to have.
Which course of action?
Which course of action, which course of treatment. Right.
Okay.
Because they vary in the different kinds of treatment.
Okay.
I mean, you heard him say, we now have ones that activate your own autoimmune system to fight it. And another one that
Turns off specific circuits within the cancer cell.
cells.
And if you can turn off, the cells can't survive anymore.
To keep it from reproducing?
That's correct.
Right. And so you want to find the right one of which ones that work.
Okay. Thank you.
I have a couple of questions. What else do you use the biomarkers for besides cancer and autoimmune? Are those the two main things, or where else would it be utilized?
Well, there are many conditions where they're being studied and used. My expertise specifically is in cancer, Madam Chair, and there are many cancers where we use this testing.
Okay.
I think Alzheimer's might be one coming down the pike, but they're not there. And under this bill, there's certain guidelines following when the FDA and all says, this is the right medical treatment and approved the medical way to go. So it's not really that it's going to be used widespread in early experiments, where normally if you're experimenting to see if they would work, you have a study and it's a controlled experiment, and they might get permission from the feds and all to use a certain kind of biomarker. But that would not be the average doctor doing oncology deciding, I'm going to do a study and I'm going to use the biomarker to try this on Alzheimer's. It's not the way it works. So your individual doctor is not going to be out there saying, oh, well, we have these biomarkers and maybe I'll just, use it on whatever I think is wrong with this patient and try it and see if it does anything.
And as a follow-up, I guess we've talked about it and who's going to pay for it and things like that. What does it cost? And is it different levels, different types? Do you have an idea, doctor, that I think this is the type that we need to run? That's kind of,
Absolutely, and there is a range. For example, when you talk about biomarkers we do for lung cancer, that ranges from anywhere from $3,000 to $5,000 for a given testing sequence.
But if you consider it, one infusion could run anywhere from $6,000 to $10,000 to $12,000. So you do the biomarker and you get the right medicine, and that's what I meant when I said you start saving funds right away. It's not down the road that you're saving money. If you keep that patient with having a biomarker and getting the right medicine, and you didn't have to pay for 2 or 3 of those $6,000 to $10,000, $12,000 infusions, you've already saved a bunch of money.
yes, sir.
Thank you, Doctor. This is a question for Chair Lady Cooper. And if that's the case, Sharon, if those savings are immediate, I'm just trying to understand, if those savings are immediate, why wouldn't the insurance companies go ahead and cover this regardless? Because it's to their financial benefit, right?
Some of them do, John, but have we not had enough bills come to us trying to get the insurance companies to do things that would save them money down the road, and they opposed them?
Well, I know not to bring a bill to your health committee. I know that much. To my
It's
my Cobb County friend, I'm trying to understand the financial benefit.
Insurance companies have told me when we've wanted to do something that would save money down the road, not even more immediately like this to get the person before you waste a whole lot of money, but who would save it maybe a year from now, that they didn't really care, because the person that keeps their insurance is probably going to change it within a couple of years, and they won't be their patient anymore. So if they don't get the right medicine to a person with lung cancer, and they go a couple of years until they have to change, the state benefit plan doesn't have that as one of their carries anymore, and they have to switch to whoever the state has approved, then that person's going to be the one that's going to have to pay with those last ditch horribly expensive hospitalizations as that person dies.
Okay,
From
yeah, I guess my
lung
question
cancer.
assumed a certain level of continuity with the same insurance coverage with the same care, and you can't
That-
assume that, I understand.
No, it doesn't happen.
Thank you, Chair.
Thank you. I don't see any other questions. We have more speakers, so thank you very much, Doctor.
Thank you.
Our next speaker is Jamie Knox, if you would come to the podium. Please
afternoon,
introduce
everybody.
yourself and
Yes.
why you're here. Thank you.
Good afternoon, everybody. Thank you, Madam Chair, for having me and for the invitation to speak in front of all of you today. My name is Jamie Knox, and if it weren't for biomarker testing, I wouldn't be standing here today. I was diagnosed with stage 4 lung cancer in December of 2018 and was told by my doctor that chemo and radiation would not have worked for me. So had they not done biomarker testing on me to find that I had a mutation called ALK positive in my lung cancer, I wouldn't be standing here today. So for me, biomarker testing has meant literally my existence. And when given the opportunity to, talk about why it's important, I always cite the fact that I wouldn't be able to tell you why it was important if I didn't have it, because it's literally the reason that I'm alive today. So I didn't ask for biomarker testing. That was the main key part of my story, is that it was automatically done for me and it was covered by my insurance. And in my opinion, as a patient, that's how it should be. I didn't know to ask for biomarker testing, and I've heard that it's not offered to everybody and it's not covered by some insurance companies. And to me, it doesn't feel like that's correct. As I stand here today, able to tell you that, I was able to get married and have my dream wedding in Savannah. And that, when I was admitted into the hospital in 2018, it was with 2.5 liters of fluid in my chest that they had to drain and extract. That radiation would not have gotten to or would not have taken care of. My medication keeps that gene from mutating and creating that fluid, and it's actually allowed me to take 300 fitness classes at my favorite gym in Savannah. I would not have been able to do that without biomarker testing. And so I just want to really implore everybody here today to, regardless of the cost, I know that's important, but understand that me as a patient, I'm important. And my life is important. And biomarker testing is giving patients just like me their lives back in as normal of a capacity as you could possibly imagine for somebody dealing with stage 4 lung cancer. So when you're sitting here thinking about the bill, I just ask that you all think about me personally and other people that are just like me who may not be offered this or may not have this option. And if you have anything in your power to fix that, I would just implore that you please consider this bill and do that. Thank you.
I have a question. First of all, thank you for driving all the way from Savannah to come up here. And I didn't get a chance to talk to you beforehand. Do you work?
I do. I work full time, yes. And I didn't miss a beat working my job either, thanks to, the testing that I got done.
So often these newer medicines do not put you in such a debilitated state as the old ones did, like the radiation on a daily basis and the really harsh cancer, just regular, I don't know what the technical name you would call them, the regular drugs we've been used to giving for cancer, were very harsh on the body. And so many of the new treatments don't work that way. I also will tell you that there's a big discrepancy in the people that are able to get these biomarker testing. And it is our African American citizens across our state that also find themselves not covered and unable, to pay for this. Luckily on our Medicaid, but still, or they are underassured and can't afford to make up the difference for many of them for this one test that would be possibly saving their lives, even though by getting it, if they're insured, it'll save their insurers money. So I would certainly ask for your favorable vote on this bill.
Thank you. We have one more person to speak, and that would be Tim Kibler, if you would come to the podium. Again, introduce yourself and who you represent.
Yes, ma'am. Thank you, Madam Chair. I am Tim Kibler with the Georgia Alliance of Community Hospitals. We are the Georgia's not-for-profit hospitals, an 85-member organization, and very supportive of this legislation. Appreciate very much Representative Cooper bringing it forward, and co-sponsorship of Representative Lumsden and co-sponsorship of Representative Taylor. We're very grateful to all of you for bringing it forward. We do feel like it is the right approach for Georgia to take, to put patients first, give the patient the opportunity, and I cannot be as eloquent as Ms. Knox, but give the patient the opportunity to live the life that we all want them to live and be a productive part of Georgia and not have to deal with the debilitation that Representative Cooper spoke to, that so many cancer patients have had to live with in their efforts to overcome cancer. I'll be glad to take any questions if there are any, ma'am.
Does anyone have a question? I don't see any. Thank you very much.
Thank you.
Thank you. Okay, at this time I will entertain a motion.
Madam Chair, the parliamentary procedure would be a motion, and then we would take up amendments, and then we take up if there's an amendment
To consider.
If there's amended bill or original, we would take up the bill as a whole, correct?
Yes.
All right, I'd like to move due pass.
Okay, do I have a second? Second. We have a due pass and a second, and there is discussion, and at this time we will take into consideration amendments. We've heard what those amendments are. Does anybody want to discuss those?
Madam Chair, I'm sorry to take up so much in the, could we go through those amendments just one more time?
Yes, I was going to say we
Which
need
one's
to.
Chair Lady Cooper? I don't want to get on her bad side. Which ones she likes and which ones she does not like? I've been there before. It's not a pretty place. I can tell you right now. Can we go through those three amendments?
Yeah, we can. Let's talk about all three of them first. I guess the first one is to say, and to mention it in here, and this is something Chair Lady Cooper indicated. Right now, it's primarily autoimmune and cancer. That's the big thing. In the future, when it is ready to be moved forward, we can come back and amend it and add Alzheimer's or whatever comes in the future. I don't know that we should leave it open to everything. Do you feel okay with having it with cancer and autoimmune at this time?
That would not be my preference, because you know how it is to come back and, I mean, we can do it. You're certainly that, Chair Lady, that's certainly something we can do, but you know it can take time to do it.
The other thing is the medical necessity. I always have felt like it is supposedly always medically necessary. Do you feel that does it make it more clear if we include that?
No, I feel like it gives more leeway to the insurance companies to deny the treatment.
Well, in this, don't we list the indications and when it is appropriate and when it's not?
Well, we do, but I just think that I know how the insurance companies work, and I think putting the word necessity in there gives them more leeway to do denials.
Okay. Any discussion with anybody? Want to chime in on this? Okay. Either one of those. All right. The last one is to have it match what is recently put in the law for the pre-certification, so it would match what others are.
I'm fine with that.
Okay. Okay. So does someone want to offer an amendment that would make this match what the standard is for pre-certification that was just passed and effective this year? Representative Gamble?
So is this amending line 64 to
Yes.
change 72 hours to 7 days
7 days and 72 hours.
and 72 hours for urgent requests?
Correct.
Okay, so would like to make the motion to amend line 64 to indicate 7 days for non-urgent requests or within 72 hours for urgent requests.
Thank you. That will make it cohesive with other requirements. Do I have a second to that amendment? Go ahead. Go.
I'm sorry, just to be clear, Representative Gamble, is that 7 business days or 7 calendar days?
What is currently in the...
It will be what's in current. I don't have the current law in front of
Is
me.
Jesse?
Jesse? What?
Calendar days?
Calendar.
Great. I'd like to second that amendment. That's-
Okay, we have a motion and a second. Any further discussion?
Wait a minute.
Okay.
Oh, sorry. We're being told it's also on lines 116. It would need
116?
to be changed.
Okay. Thank you. All right, we have the two amendments on line 116 and line 64. We have a motion and a second. Is there any further discussion? Okay. All in favor?
Aye.
Aye.
Any opposed? Okay, your amendment passes. Now we'll go to the full bill. At this time, anybody want anything else to say about the bill before we call the question? We've got the bill with the amendment.
I want to say something afterwards, if I might.
Afterwards or now?
Afterwards.
Okay. All in favor, say aye.
Aye.
Any opposed? Your bill passes. You're on to full committee, and please, if you'd like to say something, go right ahead.
I would. I'd like to thank the committee for your vote and your interest in this bill. I hope that you and your families never have to use biomarkers. But if you do, I hope this will continue to move out and those biomarkers will be there for you and that they'll be paid for by insurance. But the other thing I want to say as one chairman to another and to other members, having people decide they want to make amendments from the lobbyist field at the very last minute is very inappropriate as far as I'm concerned. And it does not, give one proper time to fully consider those amendments. And as far as I'm concerned, I would just like to say, if you're coming to my committee, you better let me know ahead of time if you're proposing amendments to any of my bills.
Well, I
And
allowed
I
it because
hated
this
to
is,
come to you,
this was a subcommittee to allow everyone to discuss it, and we came on pretty quick.
And we did.
We did.
I'm not complaining about your committee, Madam Chair. I'm just complaining. I don't use subcommittees very often. The reason I don't is in the medical field, and I know we did here, and there are a number of the subcommittee members here. Often in the big committee, we could get one person to come and testify at one time from the medical field or something, couldn't get them back. And I, wanted everybody to hear what they had to say, and it's just the way I ran my committee, personal preference. And so therefore, You know, it's just important to me to know ahead of time. I'm just fussing.
That's fine.
I mean, if that's
That's
as they
fine.
say in the Faust, I'm
And-
fussing.
Yeah, and it just depends on how it goes.
Yeah,
That's
how
really
it
basically
goes.
what it is.
So I appreciate you letting me get that out of my system.
Good to go.
And I think that probably lets everybody that's here in this meeting room know not to come to me at the last minute, or even where I have to call a lobbyist to come and say, I hear you're going to try to amend my bill or something, not to do me that way in my committee or personally with bills. Thank you.
Thank you. Any other business? I don't see any on our agenda. Therefore, we are complete.